Have some of your employees been working remotely during COVID-19? If schools reopen with children attending alternate days, will your employees continue to work from home on alternate days? Do the social distancing guidelines for reopening suddenly limit the number of employees who can work out of your current space? Or are you considering changing your business structure to include remote working as your new business model? On today's training, we will discuss privacy breach risks when remote working and how you can prevent them. You are listening to Practice Management Nuggets podcasts, tips to help you start, grow, and improve your healthcare practice and your career. I help you manage the pink elephant in the room. Get the show notes from our website at practicemanagementnuggets.live. Now, many organizations have made accommodations during the COVID-19 pandemic, and a lot of the offices are allowing some employees to work remotely. So it might be your admin support staff, it might be your management staff, it might include some of your healthcare providers. But each time that we have an employee working in a different situation, we need to make sure that we're doing a clear assessment about their new work environment, making sure that they are following the policies and procedures and expectations of that healthcare provider in the clinic, even when they are working from the remote environment. The remote environment may also have additional risks that are different from the clinic environment. So each of these need to be addressed so that you can prevent a privacy breach. We know that health information is sensitive information. Reasonable efforts must be made to ensure that identifying and sensitive information is protected from unauthorized access, loss, or damage during and outside work hours. What a custodian may consider as a reasonable effort during a pandemic may be different than a reasonable effort from normal circumstances. However, as the crisis resolves, we need to ensure that we have properly documented and fully implemented appropriate reasonable safeguards. In our healthcare practices, we have policies and procedures to identify the reasonable safeguards to take protection about personal health information. But when employees complete their roles off-site due to personal circumstances or to ensure business continuity in unusual situations, we need to take action to ensure reasonable safeguards are in place to protect the privacy, confidentiality, and security of health information. You need to determine if the remote working is appropriate for your employees. Not all employees who want to work from home are appropriate to do so because they don't have the supporting resources to enable that to happen. You need to identify what clinic or business resources are needed to provide to the employee remote worker. You also need to decide and take reasonable safeguards to implement the protection of the privacy, confidentiality, and security of personal health information. There are a few categories of common risks about working remotely. They include unclear instructions, employees not being aware of privacy and security precautions appropriate to working remotely, improper use of technology, and unauthorized access. Instead, when we make sure that we have clear instructions, a refresh of privacy and security awareness, proper use of technology, and enhanced access and intrusion detection, we can prevent many of these common risks and prevent a privacy breach. So let's take a look at each of these sections to see what are appropriate safeguards that we can use. Clear instructions. We have policies and procedures in your practice. They need to be updated and specifically reflect the remote workers. And we need to make sure that we have a clear communication strategy. Who are the remote workers going to receive their instructions from? When they have questions about the work that they do or the situation in general, who are they going to contact? How are they going to contact them? And during an incident, we need to make sure that our communication is triaged. We need to make sure that they get the right information at the right time. And when they need to get into details about a situation or to identify a potential risk and report that, they need to make sure that they know how to identify those people and be able to contact them on an as-needed basis. When we're working remotely, the routine communication may be addressed differently than the communication about a specific incident or an escalated issue. We also need to make sure that we have a monitoring system. So you might be able to automate some technology to make sure that employees are working at approved hours, that they have authorized access. But you might also need to manage the monitoring on alternate ways. So maybe there's a routine telephone call or a video conference call with your employees to keep in touch and make sure that they have the opportunity to ask the right questions and to get responses from the right people. So a clear instructions to your remote workers will help to limit privacy breaches. Privacy and security awareness. Now that they're working in a different way, they need to be able to review their work process and identify if there's any additional privacy and security concerns regarding their physical space and the things that they have, including paper and shredding. So in their physical workspace, we need to be aware of the surroundings. Is there a private area where they can work off of their computers? Or is it a shared space? Can people overhear conversations that they have with coworkers, with patients? And how can they mitigate those risks? So ensuring that the employee takes an active role in assessing the physical space and making sure that it meets the requirements for privacy and security is an active role that the employees can play as part of ensuring appropriate decisions are made about what is appropriate for remote working. Sometimes our employees have things that they need to be able to do their work. They might still need to have faxes received so that they can get the information from hospitals or do billing or get lab results. That may be outside of a secure electronic medical record systems. How are you going to manage that? Are they going to get day sheets by paper? And how are they going to enter that information into the EMR system or the paneling system? And then what are they going to do with the paper afterwards? Not every office at home has a printer. Does somebody need to be able to print, or are they going to go print from the office and have the hard copies delivered from the office to their home office? These are things that you need to think about based on their new working environment. When you assess these risks and implement the appropriate mitigation strategies, that will help you to prevent that privacy breach. Technology. When we have employees that are working from home, we've often scrambled and enabled technology to make this happen on the fly. Now we need to go back and make sure that we have things properly documented. And if we said initially that that was good enough for now, we need to go back and make it better. So when we've got employees that are remote work, or you're now undertaking a plan to have employees remote working, make sure that they have the clinic approved equipment wherever possible. If they are using the personal equipment, we still need to make sure that the appropriate technology has been applied, including up-to-date operating systems. Windows 10 has been a new operating system, and your clinic environment may have Windows 10, but the home environment may not yet. So we need to make sure that they have the most up-to-date and current operating systems. How are you going to manage patches? You've got a system to manage patches for your operating systems, your hardware, and antivirus and malware software at the clinic. How are you going to make sure that that gets done on the remote working environment? Is it something that your technology can force those upgrades before they connect to your computer network system? Or is it something that your employees now have to enable at their home environment? How are you going to make sure that it gets done? Do your employees have the technology and the skills and experience to do that, or is that something that you're going to have to assist them with? What about the routers and the Wi-Fi access points? They need to have up-to-date operating systems and the appropriate software applied to them as well. If you've got your EMR vendor, for example, managing that for you at the clinic, how are you going to make sure that it also works at the new home environment for the remote workers? These are significant areas of risk for a remote working situation. So make sure that you've taken the time to document what those risks are and how you're going to mitigate that for that particular remote worker. Now, having a good technology company to assist you is going to be critical to be able to implement remote working for many of the healthcare environments, particularly if you are using electronic medical records. Access control. When you are working within that healthcare clinic environment, you have control over the access points. You can see the computer there, you can provide that unique user ID and login information. But what happens when they are working remotely? How are they going to enable remote working? So we've heard that remote desktop typically is not the best solution. You want a secure VPN tunnel, so that has end-to-end encryption. So sometimes when we have cloud-based software systems for your EMR vendors, for example, they are able to provide a lot of that control from that cloud source software as a service, which is great. But often the other peripheral type of information for messaging and email and communications and fax controls is not included in that EMR solution. Yet, remote workers still need to be able to communicate with the clinic, with the manager, with the care provider. So how are they going to do that? So some of that can be done through the EMR system if you've got one, but some of it needs to be done outside of the EMR. Not everything we do is attached to unique identified patients. We need another alternate way to do the communication. So make sure in your anticipation of approving remote workers that you've also addressed those communication methods and the technology to support that. We also need to make sure that employees know how to spot and stop a privacy breach. Because employees are working remotely and they need to have immediate access to somebody who's going to help them if they think that their equipment has been attacked by ransomware or that they have had a theft at their remote working location, they need to know who they can contact to report a privacy breach. So make sure that your privacy breach reporting process works for employees, whether they are on location at the clinic or remote working. So you need to have a communication plan in place so that employees can report a security or privacy risk directly to their supervisor or to the privacy officer as quickly as possible. So today we've taken a look at common privacy breaches in situations where we've got remote staff working from home. Make sure that you have included this in your remote working plan. I recommend that you take a look at the remote working policies and procedure templates and the PIA template that we have provided. I'm excited about this new season, and I'd so appreciate your help to spread the word with your colleagues. First, make sure that you subscribe and add a review on whatever podcast platform that you use. Next, take a screenshot of this episode that you're listening to right now and share it on your Facebook, Twitter, LinkedIn, or your preferred social media channel. Remember to tag me and I will reshare your post. When you share the show, it makes it easier for people just like you and who like what you like to find the show. Until next time, this is Jean Eaton, your practice management mentor and your practical privacy coach.